All right. Hi, everyone, and welcome to the Dallas Plastic Surgery Podcast. Today, we're going to talk about something that I'm very passionate about. It is not only facelift and neck lift and just facial rejuvenation, but the composite facelift. So I've brought together two very special patients and friends of mine who have actually undergone the composite facelift. And just as a reminder, what is the composite? Composite essentially means made up of several different parts. And so when you get your face done, maybe you got your eyes done and you got your brow done, does that mean it was a composite because they were all done together? It does not. The composite facelift is very uniquely a technique that was carefully described and mapped out by a surgeon named Dr. Sam Hamra. So shout out to Dr. Hamra, who taught me back in 2005 how to do the procedure. It's essentially a lifting of the neck, the jawline, the cheek fat, the entire orbit, and the brow. And comprehensively, all of that is moved together as one unit, which is different than I did my eyes, I did my cheeks, I did my neck. Sometimes those procedures can kind of address each of those areas separately. The composite does it all together. So let's talk to two patients who have already done it. They're on that side of things. And I'll just ask a few questions. So I'll introduce Tori and Susan, my good friends. I would like to ask the first question here to either of you, whoever wants to go first goes first. Think back, at what age did you start thinking about a facelift? We're all kind of curious about, well, I think I want to do my neck. I think I want to do my eye. When did you decide to do it? But at what age do you recall, you know what, I've been just kind of wrangling with the idea of a facelift?
I kind of jokingly always said I was going to do it around my 50th birthday.
Okay.
And then when I got to 50, I looked a little aged, but it wasn't to where I thought that I would get a great benefit or that it would be worth doing.
Mm-hmm.
Then I went through that whole decade of the 50s, and that's where I saw, and I think I even researched it, and it said that that decade, when you go through the 50s, you have accelerated aging. And I did. So I also lost some weight. So between the weight loss and going through the decade of my 50s, I looked like an ice cream cone that had been sitting outside in July in Texas. I mean, all the skin was here, and I had always religiously done Botox, maybe some fillers, and I even tried the threading. But one of the things they said on the threading was you just have too much skin.
I don't remember you doing threading. Did you tell that to me before? I feel like is this a confession? I don't recall.
I told you that. It might have been like at the very end, but you know.
Okay, fine. I probably pulled them out.
Yeah, you probably did.
Okay.
Yeah. But it didn't really sit.
Yeah. See?
Well, I think I was a late bloomer and started actually thinking about it about 65. But I also may have had some blindness because I was
busy with your company and with your life.
Yeah, but also I do think like my mom was so beautiful, and I thought I'm just going to look like my mom. But I do, after seeing the before pictures and after pictures, it's unbelievable at really how bad I did look. But I also was a big chicken about surgery. And so I did everything, like Tori said, you go through the stages of, well, I'll get some Botox, I'll get some filler, I'll do a peel, that'll do it, that'll do it. Well, even my esthetician said, girl, there's nothing else we can do.
It's funny you say chicken. We'll definitely link to your Big Chicken Company Instagram account. So we'll tag them.
But Tori, I saw Tori's face.
Oh, that's right.
And I was like, I am so in, but maybe I'll just do my eyes. And then when I got here, you're talking to me, and the best thing about this whole thing is meeting you for actually the very first time. And I felt so comfortable. And finally, I just looked at you and said, what would you do for your mom or your sister? I really wanted to say sister, but we know where we're at.
Sister's appropriate.
And so you told me exactly what I needed. And
you know what else?
I think
in
it
this
is
era of weight loss, you guys have both successfully lost weight. How do you feel weight loss affected that aging process?
Oh, it accelerated it for sure. I mean, And my cousin pointed out to me too. She's like, well, look how all the women in our family age. And I think some of that's genetic, but the women in my family on their face, again, it all starts going south. And I remember when I came in the first time, I was coming in and I was just very unhappy about this area. And that's all I was going to do. Then when I sat down with Dr. Meade, he's like, you won't be happy. And I'm like, well, why not? And then he starts scientifically explaining to me why not. And finally, I'm just like, make me happy.
Yeah.
And that seems to be the thing, is walk in and say, make me happy, right? And then
that's the goal.
Yeah. And so I think that's when I didn't feel like I needed it. But then when I saw the result, it actually did all work together. And I created a little photo journal that I sent you of how it all worked together before and after.
Y'all both had a little bit of deflation, which is what weight loss does. And the composite lift brings up your own cheek fat. Just kind of as a reminder, the goal of rejuvenation is to have a high full cheek mass and for it to be blended with your lower eyelids. So there isn't a big distinction between eyelid and cheek. And y'all both have that really nicely. And it's not fat grafting, which fat grafting can be unreliable. It's published everywhere. The fat grafting techniques will just fill the cheek. And some people talk about lifting it and then injecting the fat, but the composite lift uniquely will raise that cheek fat and pull it towards the eye, which I think makes it a superior technique. So
that is what you did to get this, because even when I was young, I battled with the dark circles. Mm-hmm. Now I barely need concealer.
Interesting.
So I wasn't even aware this would be a result.
Benefits. Yeah, the lower eyelid fat, that bulge, it's brought down, and the cheek fat is brought above it. So I think that combination is what we can see, because I have heard several patients say, I often will tell patients, there's nothing you can do about the dark circles. It's just so hard but that mobilization of your own fat, releasing it, lowering it, releasing it, raising it, doing that overlap seems to change those dark circles in some patients.
It changed mine.
Yeah, I have none. I have zero dark circles now. And I think that's something that I probably had since my 20s that I started, first noticing it.
Okay, let's talk now kind of day to day. So now you've already gone through it. You went through the recovery. You're now at this point. Let's just tell the listeners and viewers, how far out, I don't want to put you on the spot time-wise, but how far out are y'all from the composite lift?
2 years.
Okay.
I'm 14 months.
And 40 months, okay. And, okay, so now you're 2 years out, 40 months out. This is a great time to talk, because I think often some of the little mini recovery lifts are great because the recovery is puny, but I find that plastic surgery light, sometimes 2 years, 14 months later, patients will say, well, it kind of stretched back out. It's my skin, just excuses. Whereas this is sort of plastic surgery real, as opposed to that plastic surgery light where, okay, we're 2 years and 14 months out. How does that affect you in a day-to-day life? Just think of an example that you might say recently that happened.
You mean like, how do we feel 14 months later?
How do you feel? How does it change people's comments about how you look?
Well, I can just say every single day, because I have a public-facing job, every single day someone says, you look so good. Have you lost weight?
I agree. Your eyes look so good.
Happy.
They're opened. Yep.
And I do think, of course, the facelift and weight loss, that is like the ultimate glow up.
Yeah.
But what it does to your confidence and the inside is way more important.
I love it. Now that you're this far out of it, how has it changed your daily life?
It's always complimentary when people realize or ask you how old you are. People still do that, and they're shocked. I've had different reactions like, wow, you look so good. One person immediately said, I want the name of your plastic surgeon.
I love it. Love it.
And that was really good.
Somebody get her some business cards, please.
Yeah, that was really good, because my biggest fear was I would look like Jerry Jones did. And other people that had you could just look at them and sometimes people in Hollywood that might be on their fourth or fifth. I mean, it just doesn't look like something that happens in nature. But I would say it's not a daily basis, but I would say the biggest thing for me is when I have to do a Zoom call or a Teams call and you're on a poor quality video and you're looking at how do I look and what's everybody else seeing and what am I seeing? And I think I even texted you after my first Zoom video, which was 10 days after surgery.
Yes.
And I'm like, oh my gosh, I look so much better than I did, even 2 weeks ago. And I was still in the healing process, but nobody could really tell. But I like that. It feels like my age and what my face looks like matches how I feel and the energy level that I have.
Oh man, that's great. That's so well said.
I think my face was aged a lot more than the rest of me, especially in that last decade. And I think I lost 30 pounds.
Amazing.
Yeah.
And your cheeks are so high. You look like you have fat filled in the cheeks. You have a high cheekbone. It's amazing. It worked out really well. Both of you guys do. All right, Susan?
Well, I think my day-to-day is just so great now because, for one thing, the skincare steps are a lot less. You feel more,
Interesting, yeah.
and the way you feel on the inside, because you look good on the outside, just permeates through your energy. And I think that's the reaction I'm getting from people is, oh my gosh, you look great. Oh, you've lost
And then
weight.
it's reflected back to you, and it just kind of keeps.
Yes,
That's great. I like
and they'll
that.
just say things like, men are opening doors for me.
Hey,
like,
girl.
you know how at this age, people, women, mostly all say they feel invisible. Well, maybe that was happening and I just didn't realize it because now I do get a lot more attention. I'm not going to lie.
Oh my gosh.
It's so
I love
flattering.
it. I
It's
love it.
nice. And the age thing is the same thing. How old are you? I tell them, they go, oh, we thought you were in your 40s. I go, oh, Dr. Meade, you may look like this too.
As you said, just pulling and stretching just looks unnatural. It doesn't happen in nature. So y'all both look very, very natural. And we'll post some pre and posts. I'll get y'all's permission before. And I don't know, kudos to both of you. You look so good. Your healing did very, very well. And okay, so last question I would like to ask is, now that you've been through all of this experience, a patient that's watching this will likely be considering a facelift. Should I do it? Should I not? Should I just do the neck? Should I? What would you tell yourself, the version of you 2 years ago or 15 months ago, before you had the facelift and you're nervous? Should I do it? Should I not? Should I just do my eyes? Should I just do my neck? I would love for both of you guys to comment to the patients out there that will be watching this podcast. There's going to be a handful of people watching it thinking, should I do it? Should I not? What if I just do the neck? Maybe it's too much recovery, too much price, too much, all those things. What would you say to yourself? Advice.
I think it was the very advice that in the consultation that we had when we very first met, because the thing I could see the most that bothered me was clearly my neck and this lower jowl area. Mm-hmm. And I was really focused on that. And when we had our conversation, you're like, I can do that and I will do whatever you want, which I always appreciated. It wasn't like I've been other places where people try to upsell you and try to add in all this stuff maybe you don't need, but like your scientific explanation at the beginning of the podcast, you were like, okay, this is how it all works together. So if you want this result and if you want a result that looks natural, because my biggest fear was, and I kept looking at all of your pictures on composite facelifts to see, did those women look natural or was there something scary? Because I thought, if I ruin how my face looks, then I have to really live with that on a daily basis. And I want it to look good, not terrible. So I think what I would tell myself is what I came to at that first appointment is taking the deep breath and trusting you. I think you have to have a relationship of trust that this is what's going to make me happy. And it did end up making me happy. So I didn't really hide in the shadows. I actually talked about my facelift. I think you've done 2 or 3 of my neighbors. And then I was visiting another friend of mine in Tulsa, and that's where Susan and I met up. And Susan had a ton of questions, but they were similar questions. They were questions like, I don't want my face to look freaky or weird. And then what was the recovery like? And I said, okay, well, let me share the timeline of pictures. And, you had the first 3 days of the pre-op stuff, which you would expect with any normal procedure, but it really wasn't that painful because if you touch your face, I don't think there's as many nerve endings in your face as people think. There are other body parts that if you cut on would probably feel more painful than that. Mm-hmm. And the swelling started to subside. And like I said, in 10 days, I looked good enough that I could be on a Zoom call. I was still working from home, but I think I started working again 3 or 4 days. I probably wasn't taking any pain medicine by then, 3 or 4 days, and I would work. My first Zoom meeting was 10 days, and I looked really good on the Zoom. And then it just kept looking better and better and better. So I think I would, and obviously my friends and people that knew me felt like it was a good result because they followed suit and I think became your patients as well.
That's great. Yeah. So don't fear don't make the decision based on the recovery.
That wasn't really my biggest fear. There's so much on social media about people who have had facelifts and what the recovery is. And there wasn't anything that I found that was so scary about the procedure. And for people, I broke my nose and fell and had the bone then healed in a horrible way so that I couldn't breathe on one side of my face. So I had to have a nose job. I had to have a rhinoplasty. That hurt so much more than the whole facelift because, that was a broken bone and everything else. And a facelift wasn't near that painful. So that wasn't something that I was scared of. Mm-hmm. I was more scared of if this result doesn't look good, how do I hide it?
Yeah, if it's unnatural.
Yes.
Right.
And that's, I think, most people that I've talked to, that's their biggest fear because we've all seen on social media and in magazines, especially of celebrities, people who have had a really poor result.
Yeah, that's frightening. Right.
And it is frightening.
Susan, what about advice you'd give yourself?
Well, for me, I was not worried about the outcome because I had seen Tori. My fears were, oh my gosh, I'm going to be put to sleep. I'm going to go through all these things. So I was very worried about that. But your staff and you are just so reassuring. And of course, having Tori gone through it and you have constant contact, I never felt alone. But what I would say to myself is, why wouldn't you invest in yourself for the rest of your life? If you've been a mom or a dad, you have given your life to your family or whatever you're doing. You're giving your life to it. Why wouldn't you give to yourself? And I can say that it makes a difference because it's the energy you have after you see how good you look, even if you didn't know you didn't look that good, that you're just improved and it makes you feel good on the inside and it makes you give that to other people because you feel confident and you feel good about your life. So you want everyone to feel good.
Well, I love that. That's a great, great way for us to close. Y'all's results, they're a feather in my cap, and just getting to know you guys has been so much fun. I appreciate you guys coming. I know it's a long drive and all that, but super fun every time we communicate. And I think we'll close with that. Thank you guys for visiting. That's a lot of information about the composite lift. We'll close this Dallas Plastic Surgery podcast with that. Thanks again.